Hello and a very good evening, everyone. I'm Sayukta from Radiance with You YouTube channel, and I hope all of you are doing well and staying healthy. आज एक ऐसे विषय पर हम बात करेंगे जो बहुत कॉमन है बट ऑफन इट इज मिसअंडरस्टूड। जी हाँ, हम बात करेंगे एलर्जिक रेनाइटिस पर। कई बार होता है ना, हम या हमारे आसपास ऐसे लोग हैं जो बार बार स्नीज कर रहे हैं, छींक रहे हैं, रनिंग नोज है, इचिंग है, नेजल कंजेशन है, आंखों में बार बार पानी आ रहा है, वाटरी आइज जिसे हम कहते हैं। तो ये कई बार किसी पर्टिकुलर सीजन में बहुत ज्यादा होने लगता है। ये सिर्फ सर्दी का असर नहीं है। तो ये क्या है, इसी पर आज हम बात करेंगे। और एज एन एक्सपर्ट आज हमारे साथ है डॉक्टर सांतु पटारी। ही इज एन MBBS MD चेस्ट फिजिशियन, एक्स RMO आयुर्वेद हॉस्पिटल। और आज डॉक्टर हमें बताएंगे कि किस तरह से इससे अपना बचाव कर सकते हैं, इसके सिम्टम्स क्या है और बेस्ट ट्रीटमेंट अप्रोचेस क्या है। बहुत बहुत स्वागत है डॉक्टर सांतु पटारी आपका।
Hello everyone. My name is Dr. Santu Patari. So, I think all of you are very good and healthy. So, today discussions not about very much uncommon topic, but misunderstand topic like allergic rhinitis. So, the allergic rhinitis, the defined as it is IgE-mediated hypersensitivity reactions in mucous membranes of airway. So the symptoms are nasal congestion, sneezing, coughing, runny nose. So these are the symptoms. It is not for cold, but cold about the body, but it is disturbed during sleeping or daily activity in our lives. So these sessions are mainly discuss all these thing about this allergic rhinitis. Okay.
Definitely, Doctor. We'll discuss allergic rhinitis at length in this session. And because you have very rightly said, it is quite common, especially in certain, seasons, especially
Uh,
this, because winter is here. Almost all parts of our country is experiencing winter. And many times we see people who are not actually a patient of cold and cough, but still they'll have this, a runny nose, congestion in their nose,
yes.
etc. So, can allergies affect breathing and sleep as well, doctor?
Yes. The allergic rhinitis mainly affect the breathing problems. They are for breathing problems. So I am just telling that it is Ig mediated uh, hypersensitivity reactions in the airway passages. So for allergic rhinitis or asthma allergic patients, the patients. This Ig mediated response, they can nasal blockage, some of the irritant, release of some histamine and some cytokines release for cells. This leads to mucus buildup. Also blockage the some airway passages. This leads to bronchial constructions, and this bronchial construction leads to some nasal muscles are tightening and leads to breathing hampered. So this thing happen in allergic rhinitis patients. Okay.
Any special type of allergy, doctor, that affect breathing? Anything in particular?
The respiratory allergens mainly affect for the breathing difficulty. One of the triad is they are atopy triad. That is the childhood asthma or eczema or asthma. This three triad is taken the history. Related the presence of breathing difficulty. The very much allergy are dust, pollens, or some humidity. There are some environmental changes. So these are the factors. They can mainly harmful of the body. This mediator are released and release some breathing difficulty or other some symptoms occurs.
Okay. Now, doctor, we would also like to understand which time of the day the allergies get worse, because we have seen many a times people who get up in the morning and they start sneezing or they
Okay.
complain of various, problems. So, which time of the day is when it gets worse?
Mainly the time of day allergics are increases are mainly for in night times and early morning. Night times and early morning timers the allergics are increases because of during night times the histamine receptors the pathogenesis of this allergic, the histamine receptors are increased, the receptor coughing or wheezing, or the anti-inflammatory factor cortisol are decreases during the night times. So these are the factors release increase in the symptoms in during night times. Other factors are some pollutions, different food ingestion at night times, or medication. These side effects are released from so increase these factors in the night times. Okay.
Right. And what are the common allergens that disrupt our sleep? Because as you also said, we have heard from many patients of, allergies that they get very disturbed with their sleep.
Yes, the various allergen factors are the like the first like are the some I also taking the family atopy. This one of the risk factors for these allergens are increased. Then another is the environmental changes, climatic changes. Then another the risk factors are some irritant like different spray, pesticidal spray, or smoker. These are the increase in the allergic reaction. So there are the seasonal variant and the seasonal changes, pollen and dust. These are the increase in the say, allergic asthma, allergic variant asthma, or allergic rhinitis. So there are the pathogenesis. I tell these factors, the symptoms. See the first this allergens various asthma. This release some mediators. There are some cells are present in our body, B cell and T cell lymphocytes or mast cells. This release some chemical mediators like histamines, prostaglandin O2, leukotrienes like receptor. This leads to runny nose, stuffy nose, nasal congestion. These are the factors. And the mast cells release some cell mediated response like neutrophil, basophil, eosinophil. These also that increase the mucus hyper sensitivity reactions. So all other thing is IG1 antigen, the IG mediated response. These are the mainly affect all the pollution but dust in seasonal changes, and mainly affecting the night times. Children's are mainly 2 to 3 times occur in children's according to the adults. So these are the factors. Okay.
Right. So we now understand that allergies do affect breathing, allergies do affect
Yes.
sleep, and thus allergic do affect our common, health or well-being. It do affect because sleep or breathing, of course, is very essential for overall health. Now, doctor, we would like to understand if a person have these symptoms, they have nasal congestion or running nose or a little bit of sneezing or a particular sneezing, how do they find out that whether it's allergic rhinitis or it's just cold or cough?
The this the allergic variant and cold or cough. Mainly, this is some physical examinations or patient history or some different testing. The depends on this is the allergic variant or that is the natural cold or cough. They are the most important is the family history. Family history is very important. And another thing is the different blood test, যেমন total serum IgE, one of the most important blood test. Then the allergic skin prick test. these are the tests mainly done. So this is the cold and cough. Now, this is allergic reactions the patient get for this affected. So so let us the start for the our part. The question is there. So task for diagnosis, there are the physical history, there are the patient medical history, there like family like of ATP, atopia or not, or any working history, occupational history, and patient medication history, or some nasal congestion like is clear or watery runny nose, or is pus, some bacterial rhinitis is something is there. Then patient had the history taken any chronic sinusitis or not. And then for physical examinations, go for the doctor, they do some physical examinations. Blood tests are available like total serum Ig level, uh, total serum Ig level is can see, and specific Ig level. And most important test is SPD test. SPD test is the allergy skin peak test. They dust, pollen, they get for allergic reaction. So this test for for SPD test. So one of the benefit for the SPD test is it is uh, the result is immediately came. Other test are, and one other test আছে যেমন যে nasal provocation test, one of the test is available for sneezing or severe allergic patient. Nasal provocation test is done. So sometimes rhinometry or some inspiratory allergic peak flow, these are the seen this provocation test. So these tests are the differ. So this is the cold and cough, or this the allergic variant, asthma allergic or allergic rhinitis. So according to the diagnosis, the treatment is given. Okay.
Right. So this is how doctor find out whether it's allergy or it's common cold and cough, and then they set the line of treatment. Doctor, because we are talking about allergic rhinitis, so what are the treatment options available? We would also like you to shed some light over that.
Okay. Treatment option based on there are some environmental factors are avoided, some environmental allergen factors are avoided. Then some nasal douching and medical treatment. Nowadays immunotherapy is come, and immunotherapy can, but one of the most treatment is the patient education is very much important. So for some avoidance of allergens, there are outdoor allergens and the indoor allergens. So, are avoidance. So the patient, the suggest for two avoidance are pollens or any vehicle gases, dust, mold. So these are the get for allergic. You feel this the product get for allergic. So this can be avoid. See, this is the physical factors. They increase in temperatures and symptoms occurs. This is allergic rhinitis, but it is not allergic mediated allergic response is occurs. Another is the avoid food and medication. This can lead to the allergy. So this can be avoided. Occupational avoidance the occupational thing, or your daily profession you can be get leads to allergen. So this changes the your professions. Another thing is the household dust prevention are the use some to change your cleaning your bed, or some uh, proper maintain your ventilation humidity in your rooms. uh,
Right.
so these are the main. Another is the you get allergen related to your animals like cat and dogs. So this can be avoid. And another thing is for you daily activities. So you get for glassy place, and glassy place you can visit to some hot or dry place, and to avoid face marks, or use glass. So eye allergic if occur, use some glass. So this can avoid this can use to relieve the allergy. Another thing is there are medication. So my intermediate persistence and mild persistent asthma, that is intermediate persistence means this per week, per week there are less than 4 days the allergic reaction occurs. Mild to moderate asthma is there are occurring more than 4 weeks, then hamper the or daily sleeping or daily activity. So this mild to intermediate asthma or severe asthma, use first thing, use patient education and avoid the allergens is main treatment. And daily activity changes, then use nowadays oral or topical antihistaminic is available to prescribe the doctors to all these things. If are not get this antihistaminic is got for severe allergy, then for immunotherapy nowadays came. So I guess same some medications like topical medication like topical medication like azilastins, or some steroid or corticosteroid are came, some prednisolone, beclomethasone, then nicotine receptor antagonist down montelukast, mast cell stabilizer, sodium chromogylate. These are the medicines. Other thing are oxymetazoline, xylometazoline. So these are the medications are available. But one of the say thing is the first generation of antihistaminic is mainly avoid, because first generation antihistaminic they lead to drowsy sedative side effect. Has the second generation of antihistaminic like bilastine, bilastine. So these are the medications can use to this medication used for daytime also, need not non-sedative actions. So these are the medications. Another thing is the immunotherapy. If this medication is not much helpful, then use some immunotherapy also. Immunotherapy
Right.
also benefit for this available various centers. And
Mm.
another the most important things is all the example severe asthmatic patients, they not anything is not helpful nowadays. In not for him, our India is not came, but the other USA there are some monoclonal antibody IG mediated. The most culprit thing, the IG mediated their antibody already they are established. Their name is omalizumab. Omalizumab is very much helpful for these rhinitis or allergic asthma patients. So these are the treatment options, and patient education is very important. Okay.
Right. So patient education is very important. It is very important to know that why it is important to go to a doctor and get it treated properly, why it's important to not go for over the counter medication. And it's very important to follow the preventive measures and to have that hygienic environment. It's very, very important. Now, doctor, because a lot of urbanization has already happened, we all live in metros, two tier cities, fast moving lives. Environmental factor is one thing that I would like you to shed some light. How the environmental factors, the changing, environment. We in many cities are bound to use masks regularly. Many a times we see that our kids, etc., are getting, compromised with their health due to the environmental factors. How important is environmental factor will we talk about allergic rhinitis?
The these environmental factors, here various the cities, the environmental factors like air pollutions, environmental change, environmental and humidity changes, some nowadays vehicles, the gases, and pollution, dust. These are the factors they can related the allergic rhinitis or asthmatic rhinitis patients. So these
Mm.
factors is release. I already tell this factor release for this some interleukins, other IG mediated hypersensitivity response. So this response is used to irritant the respiratory passages. There are some inflammatory processes they get leads to mucosa buildup. Mucosa buildup and bronchial airway linings are narrowing. So this leads to breathing problem. Day by day, breathing problem. The asthmatic patient, they dash for breathing problems, hampers life and sleep quality. Uh, these bronchial constructions. So there are this leads to bronchial wall. The muscle are very much tightening, and the heart and breathing problems they occurs.
Right. So, environmental factor, of course, plays a very important role. So, it's always good to be in nature. But, of course, again, in nature, because allergy can happen from anything. So, even pollen, dust from trees can also cause that. But definitely, the urbanization or environmental factor, pollution, etc., do affects our health. We are getting a number of questions from our viewers as well. I'll also take one by one, take the questions one by one. So Usha Patel is asking, do air purifiers, do they help air purifiers?
Air purifiers is you some not very much helpful, but it can use but this if any immuno systems is very much low, and this your gas for your airway is leads to any allergic reactions or any other things occurs. So you can avoid this, but daily day by day activity you can use you get not any adverse reaction or any allergic reaction, so you can be used. Okay.
Hmm. Another viewer is asking, can certain food items worsen allergies?
Yes, this is the very important question. Certain food likes some things is came for eggs, egg, and food, and some chingri dal or others or other food they can really say they can use for in night times or night times mainly affect the allergic reactions. Kaun certain this type of food is IG mediated response. They can produce some allergens, cytotoxin বা other histamine allergens they can release. So this food reach to certain itching sensation of the skin. So in home any asthma patients or any severe allergic patients or basically for small child they avoided this type of food. The nowadays allergic skin prick test is available, so this test is done if you get for food allergic. So you came the basic idea, and the testing report are come the which food are get for this allergic reaction. So so is any food they get for allergic reaction to do this allergic skin prick test. Okay.
Right. So food allergy test can also be done in case one is allergic, especially to eggs or seafoods, etc., which are very common allergens. I'll take few more questions. Aditi Srivastav is asking, can allergies cause ear blockage?
Uh, Not so much. Your allergic reaction is nasal blockage is occur, but if get for severe allergy and avoidance, you get for allergies occurs, but is not go for doctors by others, and it is day by day is so much increases, then it get for nasal passage also, nasal terminate also they can impact it, but not so much common in nasal blockage. You can ear blockage, but nasal blockage is something common because some other people are deviated nasal septum or terminate hypertrophy. This can related to get for allergic reactions.
राइट, तो अगर एलर्जी है तो बहुत लंबे वक्त तक उसे नज़रअंदाज नहीं कीजिए, डॉक्टर के पास जाइए, सही सलाह लीजिए, सही इलाज लीजिए, ये बहुत ज़रूरी है। क्योंकि अगर वो एलर्जी बनी रही तो जैसा कि हमारी एक व्यूअर ने पूछा था, क्या उससे कान का ब्लॉकेज भी हो सकता है? तो हो सकता है कि बहुत लंबे वक्त तक अगर आपने इग्नोर किया हो अपने कंडीशन को, एलर्जीज़ को, उसे ठीक कराने की कोशिश नहीं की हो, तो इस तरह की समस्या हो सकती है। There's one more question by Sayyid Rehanali, and his question is: are home remedies helpful along with medicines?
uh, Home remedies, one of the thing is there are the home remedies is helpful. One of the procedure our name is nasal douching, that is the nasal irrigations. Some of the people the home remedies they like a water they can use nasal area, they cleaning the nasal area, and this can
Hmm.
full helpful. But
Okay.
if get moderate to severe persistent asthma, so use some antihistaminic also. And one other thing is if patient get deviated nasal septums, जैसे नाक का हड्डी को थोड़ा प्रॉब्लम हुआ तो नेजल पैसेजेस ठीक नहीं रहा तो उनको होम रेमेडी करके कोई फायदा नहीं है. So they take
हाँ.
some oral medications or some topical medications use or treated this underlying condition or surgery. So this according to these conditions patients. Okay.
बिल्कुल, तो पेशेंट की कंडीशन के ऊपर डिपेंड करता है और ऐसे में सही जाँच करा लेना बहुत ज़रूरी है। ऐसा ना हो कि हम इस भरोसे होम रेमेडी करते रहें कि ये ठीक हो जाएगा, लेकिन प्रॉब्लम अंडरलाइंग कंडीशन कुछ और है। तो ये भी बहुत ज़रूरी है। व्हाट चेंजेस कैन आई मेक एट होम टू ब्रीथ बेटर? ये एक बहुत आम सवाल है जो बहुत सारे लोग इस वक़्त पूछना चाहते हैं कि क्या करें घर में ऐसा सो दैट वी कैन ब्रीथ बेटर?
हाँ, first your the allergen to breathe better are first to maintain the proper ventilation and humidity of environment in home, and also to cleaning your bed or your some microscopic part of there are area of the bed, so this daily cleaning your bed, and also to avoided some allergens they get for as asthmatic to food, if any food, any medications, or these are the they get for they give for allergic reaction, so they can avoid it. Another thing is the uh, some if a get for nasal blockage or nasal congestion occur, they leads to breathing difficulties. So not go for supine or lying down positions. You must be go for standing positions. So and to clean your noise or nasal passages, they again and use some topical antihistaminic. So nasal passages are clear, so you get for breathing is so much easier. So this can apply also home.
Right. So having good environment inside the home also can give you some relief. But still, in case you have allergy, please do not stay with the symptoms. Go and consult a doctor. They'll help you to come out with it. At least if you get to know the trigger, you can avoid or, lessen down the trigger. That will also
Yes,
help.
yes,
Right. Another question: can pets worsen allergic rhinitis?
yes. Pets like dog or some cats. These
Right.
pets are very much important for least for allergic rhinitis. Day by day, our daily practice time, these patients are came for because every house is pets and dogs are available. So these pets are dogs also, there are some release some some antigens. These antigens, especially for a child are playing, or these pets, or these pets really leads to some itching or nasal irritations, like but it these nasal irritations occurs, or sneezing, coughing. These enter the nasal passages, and nasal pathway are blockage. So this leads to some these allergens are released. So this leads to some sneezing, coughing, other problems. So if get for pets like dogs and cats in home, better to avoid, especially for child. This can lead to in severe allergy for this. Okay.
राइट, तो अगर सिवियर एलर्जी है तो पेट से दूर रहना चाहिए, खास तौर पर बच्चों को भी पेट से दूर रखना चाहिए, नहीं तो एलर्जी और ज़्यादा वर्सन हो सकती है। बिकॉज़ वी आर टॉकिंग इन लेंथ अबाउट allergies, we would also like to know, doctor, any age correlation between allergy and sleep disturbance?
Age is one of the things to get allergic rhinitis, allergic variant. See, our immunity depend on these factors, immune systems. Our so all are the immune reactions. So the immune reactions are depend. So this age very important, like small children or older age. So these small children and older age. So these patients are get for allergic reactions, uh, because their immunity are low, above not very much. Children are immunity are purely developed, and older age some other comorbidity factor, obesity, or some thoracic pathway or abnormalities, or some other factors. So these factors are comorbidity conditions. The other comorbidity conditions in older age are very much common. So small children or older age to better to be cure and avoid this. If you get occurring allergic reaction, you get avoid this.
Right. One more thing, doctor, can allergies cause sleep apnea?
Sleep apnea is basically sleep apnea. The term is uh, certain stop breathing at night times or start
Yes.
because of nasal blockages. So this is called
Hmm.
obstructive sleep apnea. And some central nervous system signals or abnormalities are this called central sleep apnea. So patient sleep apnea patient, there are loud snoring and gasping of the air, so breathing, um, and so this type of occur in sleep apnea patients because of the more sleep apnea patient because of upper airway resistance and airway irritant. These are the fact leads to sleep apnea patients in allergic rhinitis is most common. Upper airway resistance because of the some upper airway, like in night times the some nasal muscles are relaxed, so this sleep apnea patient, their tone are increased, and also the heart palate and tongues, this tissue are blockage, these tissue are blockage in sleep apnea patients. Also airway turbulent factors. So these are the factor, this leads to upper airway resistance. So patient go for this blockage. So patient go for nasal blockage, and patient go for breathing for you open mouth, not for noise. They can breathing. So these two loud snoring and sleep apnea patients, and also low air flow, or some increased air passages, that is like apnea in mouth. Also oxygen levels are low in sleep apnea patients. So these allergic factors, if are occurs in some other peoples, so these factors are released, hamper the sleep apnea anatomical structures. So this leads to sleep apnea patient. Sleep apnea is very much high, and sometimes patient death also in sleep times. So sleep apnea patients is go for allergic rhinitis, is do for proper testing in allergic. So do I have tell all the thing, this testing and proper cure, because it's already your blockage your thoracic passages. So if you occur any allergic reaction, these blockages are so much increase, and your breathing pattern is become hampered. So the
Right.
cures.
Doctor, one more question by one of the viewer. Do mask reduce pollen and allergy symptoms?
If you get your feel the your sneezings or occurs your home working time, or some nowadays to chula randhing chula cooking is common, your gases or your vehicles gases, so you better to avoid and this use some masks, because these gases are increasing nasal passages, and all these thing allergic reactions occur. So basically this is
Right.
the mainstay for use some mask. Second thing is the use some medications, nasal spray or antihistaminic tablet. So these are the use, and avoid these factors. So marks those patients are suffer from allergic rhinitis with gases and pollen or pollution, marks must be used.
Okay. Ankita Charasia is asking, does cold food or drinks increase allergy?
Dust, cold and flu. Yes, flu is one of the symptoms of allergic, that is the high fever, one of the days. But dust, if I get your dust or occurs, so you get for
But
this
she's
leads to the.
asking, doctor, does cold food, something which is chilled, some drinks which are cold drinks, chilled with ice, do they also affect allergy?
Yes, yes, yes. This cold, they this cold gets to nasal irritant. These also release some Ig mediated response, and nasal passages are blocked. So these are the one of the symptoms for allergic reaction. This can occur. So you avoided this cold thing.
Right. Okay. Doctor, before we sum up the whole session, any take home message or anything that you would like to tell us about how we can control to reduce the effect of allergy on our sleep or on our breathing?
So basically, I tell the all these things. The allergic reactions mainly that depend on the immune systems of there are uh, you are or the immune system is not much same. So low immune systems, basically old age or some childrens, their low immune systems, they get for this type of allergic rhinitis, where so something common is allergic rhinitis. Asthma is before it came. So I think if you feel this type of symptoms like nasal congestion, coughing, wheezing, or nasal passages block, you go for this clinic or hospitals. They test some physical examination, history, or blood test. Even also children also, because early diagnosis is most important, because the if late diagnosis, then patient respiratory systems go for hampered. So, because of their inflammatory changes occur, they go give for upper respiratory tract infections, or give for some complication, nasal polyp, sleeping disturbance. So these are the occur insomnia like symptoms occur. So early diagnosis is very important, and these gave for some testing in doctor like allergy skin prick test, total serum IgE, or some nasal provocation test. If something test are came, so you if get for any allergens or any food, the test results are came in skin prick test. So according to the treatment are suggested by doctors. Or another thing is the to avoid, and I think to tell the to avoid allergens, those are get for this allergic reaction. This is very important. And patient education very important. And to avoid the cats and dogs,
Right.
if go for home. And another thing is the medications, to use some medications not for non-sedative medications, with the use some daytime also, because those are some job or any daytime job, by any working lifestyle. So non-sedative medication also helpful in allergic reactions. Then certain, if are not get any things, and moderate to severe, go for asthma or rhinitis, immunotherapy are available in our institute, by other institute, immunotherapy are available. So be protect and be safe. And main treatment is to avoid allergens also. It's not early, go for doctor clinic. If your allergic symptoms are occur, go for doctor clinic. They can prescription, and they can treat it, and they can suggest all these things. Okay, thank
Right. Thank you so very much, Dr. Shantu Patari, for your valuable insights and for helping our audience understand allergic rhinitis better. This session has truly been informative and very helpful for our viewers. Thank you so very much once again.
you. Thank
And viewers, thank you for joining today's session. It was issued in public interest by the makers of Lulibor Lotion Advanced Gen X, a division of Hetero Healthcare. Stay connected with our channel and don't forget to subscribe to Radiance with You. Thank you and have a great evening ahead. Goodbye.